The Ghana Health Service says Achimota Senior High School has recorded 135 positive cases of COVID-19 as of Saturday, July 3. It said some of the infections were caused by the Delta strain. The earliest documented COVID-19 case caused by the Delta variant was first found in the Indian state of Maharashtra in October 2020 and has since spread widely throughout India and across the world. Dr. Patrick Umabuaji, the Director General of the Ghana Health Service, at a media briefing in Accra on Sunday, said the cases were detected after 843 students and staff of the school were sampled and tested. They included 348 boarding students, 459 day students, and 36 teaching and non-teaching staff, he added. The Director General said 550 results of the tests conducted were available with 293 pending. He said all 135 cases were either asymptomatic or had mild to moderate illness at the time of diagnosis.
All the 135 cases at the time of diagnosis were either asymptomatic or had very mild to moderate illness. One staff was also recorded positive, and about two tests, that's about 89 students and staff have recovered, accounting for 65.5% so far. So the active case, the number who are still in carrying the virus, about 46, as I mentioned earlier.
Dr. Umabuaji said as a measure to avert the further spread of the virus, the Ghana Health Service had begun education on all COVID-19 infections and preventive protocols at the school. He said the service would also review daily cases and discharge eligible students and staff on isolation based on Ghana Health Service discharge policy.
Health education on all public protocols has been intensified for both day and day students and then the students and the teachers. We review the cases daily, and discharge of eligible students are being done based on our discharge policy. That's 14 weeks, 14 days from the day we tested positive. We have intensified the enforcement of the infection prevention and control practices on campus, and disinfection of all places of concern are being done. Classrooms, vehicles, etc. are all being done currently. We've also had to do some strategic testing of all these students to identify and contain the community spread, because Achimota overall has about over 800 day students who commute daily. For the current situation, about 500 students are day, and so if there's an outbreak there and they are going home and they are coming back, it's a group of concern to contain community spread, and that is why we've had to test all day students. From that, so far we've tested nearly 500 of them. The number that has come in of about 221, we've seen about 21 of them are positive, which adds to the active cases that we have now. And so that is the way that we're now going to follow them up to their homes and see how we can enhance contact tracing and do further testing for their contacts, and at the same time those borders and things that they've come in contact with be tested. Just this is to help assist us bring the outbreak to an end.
Dr. Patrick Umabuaji said the Alpha strain had been identified as the dominant strain in Ghana out of a total of 1,212 genomic sequence of COVID-19 samples done since July 2020. The Delta strain was first detected in Ghana in April 2021 among international arrivals at the Kotoka International Airport, and that the strain was detected in the community in July. He expressed worry over the non-adherence to COVID-19 protocols, saying the confirmation of the Delta variant in the community can cause an increase in infections. Dr. Umabuaji stressed the need to enforce existing protocols on COVID-19 and assured of access to vaccines for the general population. He urged the public to mask up, observe social distancing, and wash hands regularly with soap and running water. The World Health Organization labeled the Delta strain a variant of concern on May 11. The variant is now present in about 80 countries, including Ghana, and is the most transmissible coronavirus strain. Symptoms of the Delta strain identified so far include headache, sore throat, runny nose, and fever. More traditional COVID-19 symptoms, such as a cough and loss of smell, is said to be much rarer now, with younger people experiencing more of a bad cold. The World Health Organization has, however, warned the Delta variant is highly contagious and the fastest coronavirus strain that will pick off the most vulnerable people in places with low vaccination rates. So far, Ghana has confirmed 96,067 cases of COVID-19, with 1,602 active cases and 796 deaths. Ascend Central Member of Parliament Honorable Kennedy Japan on Monday presented a check of $100,000 to the 37 Military Hospital as part of his promise made to construct an ultra-modern cardiothoracic center for the hospital in Accra. On June 22 this year, the philanthropic legislator cut a sword for the commencement of work for the 80-bed cardiothoracic center in fulfillment of a promise he made last year when he made a donation of some medical items, including personal protective equipment, during the onset of COVID-19 pandemic in Ghana. The check will be used for paying the expenses of medical personnel who will be managing some specialized equipment to be used at the proposed cardiothoracic center at the 37 Military Hospital. The trainee medical technicians 18 number will be undergoing their training in India. Honorable Kennedy Japan, in a short speech, reiterated his mission. He said this was important because the medical technicians needed to be trained to man the equipment.
I was informed that we would need doctors to be trained in India, and they needed about $77,000. So I offered to help, that I'll give $100,000 for them to go and train. So I'm here this morning to honor my promise. I brought the $100,000 for 8 medical practitioners to go and train in India and come back so that they can well man the cardiothoracic center that we are building. That is why I'm here this morning.
He also revealed that some of his friends have agreed to help and support when he has started and urged all to keep faith alive.
My for be approach me, said they also want to help. The Mekachum say, I have to consult the hospital. We need more doctors. $11,000 there. I think it's very, very reasonable. We go American, we can train more doctors and health practitioners. Probably we will extend it to other departments. Let's see how the response will be.
He shed more light on some of his friends who wanted to come on board. He also hoped that come same time next year, the edifice would be completed. He also used the occasion to call on all Ghanaian politicians to contribute to the development of the country. The commanding officer of the 37 Military Hospital, Brigadier General Obodai, also shared his thoughts on the presentation with the media.
Brigadier General Ni Aja Obodai, Commander of the hospital, 37 Military Hospital. Now, we're gathered this morning, like you heard the Honorable say, in fulfillment of his promise. After cutting the sword nearly 2 weeks ago, we realized that we had to do some training for our specialists who will be in charge of the place. So he generously offered to take it up as well, to do the further training for them. So he's here this morning, like you saw and you heard, to present 100,000 cedis check to the team that is going to go so that they can do further studies and train further so that when the place is completed, they will definitely be in charge, fully equipped. That's the reason for the gathering this morning.
All right, how many beneficiaries are going and what is your word of personal advice to them?
Well, for now, we have 8 lined up. The cardiothoracic surgeon himself and a team, and the anesthesiologist, pharmacists, cardiologists. So the initial training set is 8. But like he said, subsequently, we'll have to train some more so that they will join up and assist the team. But the initial training for now is 8 medical personnel who are going out.
So the word of advice to the beneficiaries?
Yes, okay.
Word of advice to the beneficiaries?
To the beneficiaries? Yes. Well, that's a lot of money as well. We know how much is going into the building itself. And this other additional one, $100,000, I thought I said 100 cities. $100,000, it's a lot of money. So for whoever is benefiting from it, necessarily they must also put in their best to make sure that we get value for money. It's not just money that's being thrown out, it's money that's being put out for good use. So necessarily being who they are, they know exactly what to attach to it so that we get the maximum of this donation as well. So they have their matching orders as well.
Raphael Adevu site foreman assured the public that the work will be completed on schedule.
Okay, so far as you can see around, before we came there were existing services on the ground. The gas pipeline, electrical line, data and other stuffs, including the waste pipe as well. So we've now tried to relocate the waste pipe alongside the building. That is what we've done now. And now we are doing the excavation for the relocation of the waste pipe once again. And we've also purchased all our iron rods, the stuffs at the back of this building. And the layout too is already done, which you can see the excavator excavating the columns. So when we hope by 2 weeks' time, we'll be out of the ground, and then you see the building afterwards. Right. We've had our plans even to finish before the dead time. Yes, we have our plan in place, putting things together. You can see for 2 weeks now, you can see what we've done. We've done so far. Yes, so we have our plans underway.
A dredging exercise has begun at the Westlands in Ghana's capital, Accra, aimed to reduce possibility of flooding. According to the contractor, Mr. Dramina, the main challenge facing the community is the improper disposal of waste. Mr. Dramina commended the Member of Parliament for Yawaso West, Madam Lydia Alhazan, for her kind gesture. Na de yahu aha ne say wo hwa soro ha kura utimi hu omugu bola gum eti sa wo hwa ba bia say excavator ni gina sesi ana bola ni bisu na ogina na oyi no eti ka tambia na ye be disot na ye di begu esoro no e wo sa etimi serve as an embankment na etimi guide afiafie na wa ha ne say de nsuo no eyiri a entra enkofie no na nso nipa kro ya sesa kwaya failing na bi di twa blocks eti tambia na mo level no eguso wo fom eti nsuo ni fi ha no na ebesen a eye mapa de fire kira ha no entimi emma me senko na eho no astay na ewuru fa so na start wurawura enkrofo fie eno ni challenge a ewo sa area ha no no eti de me hu ni say ansa na ha problem no betimi asolve no just say hydro for no boa na ya biem left and right na mo ya very big storm drain to say alajude no eno na betimi accommodate nsuo na efi soro ho ebesen akono honorable leader Alhassan adwuma ho ye wo constituency ha de me kada bia say MPC no ye nyane say be ya 20 kra Ghana ha enka nipa bebre no enye dede na MPP no si abehwa ya na dodo na ya beto aba ana omu uhu nyuma bi say koso but ono de onhwe ni sa ana even nyuma kra was spreading across Ayawaso West constituency ha no mo no a me gidi say ana me nyi ni say MPs na aka ni bi atutu sa na mo no eti dwuma de wo ye bi pa wo constituency ananso nipa be ye bi no amenye di nyina enye den anya ne obe nyina na beso nipa ni nanso de o ye ne de ye mu bi de ye hu ni so o ye kwani mu pa sen MP binumu a ye ni mu. On his part, the supervisor of the project, Mr. Ofori, mentioned that some people go for the heaped sand, which serves as the boundary to build their houses. He therefore cautioned them that anyone who would be found guilty of such will be strictly dealt with.
Once you heap and otiegu, I say, one casanum be a boy amania say, I has say na ye heap notiano, ye heap a yacono. No more status of Musisi Dano and Ketuano, no more tree and home and notiano. Ede ko eti de me ba ya na asema ye kan se ade a ye no eye ka ene aye oni pakwan ye be hu se wafa ahase ye ni bi no tie ni bi ede ko fele eye ni fie no adwuma ye be di no emfa sempa emma eti no wonia kakra MC ye de be ma ahafo no enna ni titiri bola ye ba ye nso iton ra no bola pa na eba no na nye bola ketwa eti half one percent begina NET2 de wo kasem ba ko a ekọ ba bia etimi gina ha aka kire hafo na ete ha se bola no aye yie omunyai enso na nkasa mpe bola.
Some residents also expressed their appreciation.
Bachoya ha okesia wa ni se edunsuo tobremu a nsuo na yiri gota ne ye ma yiri be fire ye dem ne ma ni nyara enti esra ban se ye panichew any assembly woman omuwa ha ne MPs na omuwa ni nyara se omu be hwe ye ha wa ye dem no mu siesie gota no ma ye na nsuo no ja yiri.
How de ye wo bi bebre wa ha se ebi ni nsuo no any gota no because ye betra ha na chepa na gota na enye se na etie obi timi ka se na ye betra ye nim se nsuo wo ha na ye betra enye se ye nim se nsuo wo ha ye ba ha no na gota na ye gota kiti se na e wa se na nsuo se na ye betum na ya ban mu na nti ye ban mu se ya nsuo na e ba enya kwanko
nti ye ka kire omo amutu bolagu gota no mu se sisi aya ya be yi gota ban ya be mai serum abe yi gota no ma ye no wa se sika bebre ansa na oyi mu enti omo amutu bola ni niamaniama gu mu se na eya esi nsuo no kwan se ba nsuo no be yire ye no ye sero mu bebre se efri na ekọ no omo be ye sa de no biom se na de o ha bebre ye biom wa ha no